Hi, I'm Don McCarthy, psychotherapist at My Therapy NYC. The title of this video is Do I Have OCD? Symptoms of OCD and How to Manage Them. What is obsessive compulsive disorder? The International OCD Foundation defines OCD as a mental health disorder that occurs when a person gets caught in a cycle of obsessions and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that will then spark intense, uncomfortable, and distressing feelings. These obsessions can produce extreme anxiety in a person with OCD to the point that it severely interferes with their everyday life. Some examples of obsessions are contamination fears about germs, disease, or environmental contaminants, fears of harming or fears of acting on an impulse to harm someone else or oneself, or unwanted sexual thoughts. Compulsions are the second piece to OCD. Compulsions are the repetitive behaviors that a person with OCD will use to counteract or make the obsessions and anxiety go away. However, this behavior is only a temporary relief until the obsession returns and the person with OCD is caught in a cycle. Some examples of compulsions are washing and cleaning excessively, checking for safety or that nothing terrible has happened, or repeated routine activities like coming in and out of doors or sitting up and down in chairs. What are some misconceptions about OCD? The term OCD has crept into everyday language, and there appears to be some misconceptions about obsessive compulsive disorder. Phrases like, "I am so OCD," is a good example of this misunderstanding of the condition. For example, merely having obsessions or intrusive thoughts does not mean that a person has OCD. You may have worries about someone's safety, or getting to places on time, or making mistakes on your job, and these thoughts may cause anxiety or distress. But the person without OCD can usually eventually work through the stress or anxiety and get back to everyday life. The person with OCD cannot move on, and the thoughts will trigger extreme anxiety. And remember the second piece to OCD, the compulsions. So also, merely having regular routines or being meticulous in organizing or other compulsions does not mean that you have OCD. Remember, the compulsive behavior helps the person with OCD to relieve the anxiety. And the cycle is so extreme that it really disrupts everyday life. How can I be sure that I have OCD? Only a trained mental health professional can diagnose OCD. If you or anyone you know experiences obsessions and compulsions that interfere with everyday life, such as school, work, or personal relationships, then getting an evaluation may be beneficial. For more information about finding a mental health professional who treats OCD, check out the International OCD Foundation website, iocdf.org. What are some tips for dealing with OCD? Well, after getting a therapist, some other tools and tips may be helpful in managing OCD. Some call OCD the downing disease. So during the obsession and compulsion cycle, the brain is going to doubt and seek reassurance throughout the obsessions and compulsions. And then the body responds with greater and greater anxiety and can get caught in a flight, fright, or freeze response. So one of the first steps is really slowing down and beginning to recognize that this is a cycle that's happening, maybe even telling yourself that, perhaps even recognizing that this is just my brain trying to protect me somehow. Begin to notice if you can separate yourself from your thoughts and naming it for what it is. And for more information, check out our website at mytherapynyc.com.